Hi, I'm Dr. Chris and I'm with Physical Therapy Solutions. I'm a McKenzie certified physical therapist, and today I want to show you something that's going to save you a lot of time, money, and worry. In this video, I want to teach you how to treat your own neck. We're going to address present problems you have and potentially treat future symptoms as well. This is a 6-part video based on the McKenzie method. Before we get started with the exercises, let's talk about safety. If you have any of the following, I urge you to stop and seek out medical advice. If you have hand or wrist pain and finger numbness, if you've been in a recent car accident that's causing your neck pain, if you have headaches that are getting progressively worse, or if you have headaches along with nausea and dizziness, or if you're starting these exercises and while doing the exercises you're getting progressively worse, I urge you to seek out medical advice or give me a call and I'll direct you as appropriate. In this section, we're going to talk about understanding your cervical spine. There are 7 bones in the neck, and the main function is to hold the head on top of the shoulders. Now, inherently, there's a lot of flexibility in the neck, and there's 2 positions that really seem to stress the neck a lot. And here they are: forward head posture and a bent neck. Try this experiment with me. Take your finger and bend it back. What you're going to experience over time is mechanical pain if you hold it hard enough and long enough. Now, the reason for that is because the ligaments around the bone are stretching and they're straining. Now, if you fail to heed the warning of pain, what can happen is the tissue around the finger joint can damage, and then you'll still have continued pain even after you stop overstretching. That same exact thing can happen in the neck and every other joint of your body. Okay, so positions like this and this, you are basically experiencing that mechanical strain that can lead to pain. Now, if that happens long enough, the bones and the joints can distort, and you could actually get a bulging disc to touch on the nerve and give you subsequent arm pain. Okay, in this part, we're going to talk about common causes of neck pain. I already showed you the 2 positions, forward head and bent neck. So let's apply that to the sitting position, and I'm going to show you how the low back influences your neck. I just want you to appreciate what happens if I actually round out my low back. I can't pull my head back over my shoulders. It gets stuck. It's even hard to rotate in this position. But if I actually keep a hollow in my low back, suddenly I can take my head and put it over my shoulders. Now, I'm free to rotate. In order to properly sit, you want to look at a few things. The knees, the hips, they need to be at 90 degrees with some back support, and that allows me to hold my head in an optimal position. Now, you know that if you go to different situations, like if you're sitting on a bus, if you're on a plane, if you're at work or home, the chairs, they're not always very conducive to that really nice position. So it's important that you modify your position to allow for your neck to sit on top of your shoulders. Don't get caught doing this for too long. Okay, part 4 of this video, I'm going to show you 7 exercises that are carefully designed to reduce the symptoms that you may be having right now. Exercise number 1 is called retraction. You're going to sit up nice and tall. Don't slouch during this exercise. Come up nice and tall, head back. You want your eyes on the horizon and pulling back. Common mistakes are looking down and looking up. You just want to translate your head back, just like this. You could use your hand to give a little overpressure and guidance. Exercise 2 is going to be pulling the neck back and then looking up. This is neck extension. Exercise 3 and 4 are the same as number 1 and 2. They're just in lying position. You're going to pull the nose and eyes back into the table, just like this. You don't need to use a pillow. You're just going to pull back. Exercise 4, make sure you have clearance here. You're going to go back, like exercise number 1, and then extend your neck. Retract and extend. Okay, that's exercise number 4. Exercise number 5 is going to be side bending. Okay, so you're going to sit up nice and tall, keep your neck in that kind of one position, and you're just going to bring your ear to your shoulder. Just like this. Be careful not to bring your nose to your shoulder. Hold it here, ear to shoulder. Exercise number 6 is rotation of the neck. You're going to look to your right and then come on back. Just like this. You can add a little overpressure. Just like this. I'll do one more. Number 7 is going to be, again, you start in that number 1 position and then you bring your chin to your chest. This is neck flexion, okay? Nice and tall, drop the eyes, a little overpressure, and then relax. Those are your 7 exercises to fix the neck. Okay, in part 5 in this video, we're going to go through 7 exercises and a few scenarios in how to implement them into your routine. Let's say you're in some significant neck pain that is constant or come and go. Always start with exercise number 1 and 2. So let's go over those. Sit up nice and tall. I know you have some neck pain maybe in the center or maybe on the side. I want you to do retraction. Pressure on, pressure off. Just like this. In the first few repetitions, you may get some increased pain. Don't worry. Keep going. Go right into the pain. Try about 4 or 5 repetitions. See if it starts to change. If it starts getting better, keep going. Give me 10 reps. If it continues to get better, I want you to do 10 repetitions and then add exercise number 2. Ten repetitions of each. If they're making you better, or if they're making the pain go to the center of the spine, continue, keep going. If it's too much pain to do this and you can't tolerate it, we're gonna try those same 2 exercises, but we're gonna do it in lying position. Let's try number 3 and 4. You're just gonna pull the head back into the bed. Again, what you're looking for is a decrease in pain or a centralization of the symptoms where the symptoms go from the side back to the center, the base of the neck. That's a good thing. Keep going. Pressure on, pressure off. If that's helping you, we're going to go to exercise number 4. Here, you could use your hand to support. And then come on back up. Try those. If exercise number 1 and 2 help, stay with those. If it's too severe of pain, you can't tolerate it, do 3 and 4. The goal is to go back to a sitting position so you can implement exercise number 1 and 2. Whichever set of exercises was helping you, I want you to do 10 repetitions, 4 to 5 times a day. And very importantly, you have to fix your sitting posture. You can't get away with doing this or this and expect to heal. We've got to interrupt that regular habit of bending the neck with those exercises. In this section, I want to talk to you guys about headaches. The reason headaches occur is typically because of a poor neck posture. Now, if I go here and I hold this position, then I'm compressing the top 2 bones of my neck. Now, if you sustain this long enough, you can actually get irritation, you can get local neck pain, or you can get a headache that comes around the top. Now, what do you do to kind of fix a headache if it's actually coming from the neck? Is typically do the opposite. So the opposite movement is going to be in exercise 1. Right here. So if you experience headaches, start with exercise 1. That's your foundation. Okay? So you do pressure on, pressure off. Pressure on, pressure off. 10 reps, 5 times a day. And of course, fix your sitting posture. You can't keep going back to this. You'll still get the headache. Now, if you've done this 10 repetitions going all the way back 5 times a day, and you're not influencing your headache, or if it's not quite getting better, I want you to add in exercise number 7, which is going to be the flexion. So again, it's here and then here. Pressure on, pressure off. Pressure on, pressure off. If you're noticing that these are influencing your headache, that's a good thing. Continue with that. If they are not influencing your headache, then you need to switch over to a sustained hold. Try this. Exercise 1. And you do a 2-minute hold. Hold it as hard and far back as you can, just like this. Now, if you notice with these exercises, they're all doing the same thing. They're opening up this area because it's been closed down for a little while. So we're trying to stretch out that upper cervical spine, just like this. If these exercises are not influencing your pain and they're not changing, I urge you to seek medical advice or give me a call and I'll direct you as appropriate. In this next scenario, I want to talk to you about a different way of managing your neck pain. Let's say exercises number 1 or 2 or 3 and 4 are not helping you and you have this pain that's kind of located on the side of your neck. You actually may need a different movement. Here's that movement. It's exercise number 5. Sit up in nice tall posture, retract the neck, always keep your ears over your shoulders, and you're just gonna side bend towards the pain. Don't go away from it, always go towards it, just like this. Careful not to look or rotate with your nose. You wanna bring your ear to your shoulder. You can add a little bit of overpressure. Again, you're looking for that same scenario. You're looking for pain to move away from the periphery and back to the base of the neck. If this is helping you and it's decreasing that pain or centralizing it to the base of the neck, keep going. 10 repetitions, 5 times a day. Just like this. Once the pain is at the base of the neck, then you can go back to exercise number 1 and 2. Your pain should be replaced with stiffness. We don't want this pain to stay in the arm or in the side of the neck. We want it to go back to the middle. And as always, make sure that your posture is good and you're fixing your sitting position. In this section, I want to talk to you about prevention. So let's say you've gone through some of this information, you've kind of worked out your own neck and it's feeling better. Now, that doesn't mean you're out of the woods. Spine mobility and health is our responsibility every single day. So if you're feeling good, what you need to do daily is check your neck, and this is how you do it. Rotation, rotation, 10 repetitions in each direction, followed by 10 repetitions here, followed by 10 repetitions here. So you're essentially doing exercise number 6, 10 times, exercise number 1, 10 times, and then exercise number 2, 10 times. Now, if you do that daily, your chance of recurrence is going to go down significantly. You combine that with good sitting posture and you're well on your way. In this section, we're going to talk about recurrence. Let's say you had neck pain and then it went away. You're feeling good, you have full mobility. And then you have an episode where it comes back. At the first sign of recurrence, what you want to do is exercise number 1 and 2. Again, upright in good posture, go to exercise number 1, 10 repetitions. If that's okay, go to exercise number 2, 10 repetitions. If that's too tender and you just can't get in that position, go to exercise number 3 and 4. It's the same thing, but it's on your back, here and here. And of course, maintain good head alignment as you do it. If you find yourself in a scenario where acute neck pain strikes, here's a few things you should remember. Number 1, maintain good posture. Number 2, don't just let your head fall down like this to try to avoid the pain. Another one is don't roll your neck around. This is not a good idea and not one of the good 7 exercises. Another thing you want to do is you want to avoid sleeping with too many pillows or face down. Also, be careful with lying in the tub because these things can pull your neck forward like this. What you want to start doing is commence the exercises and see what happens. Observe your pain, and if you're having problems, give me a call and we'll help you find a solution. I hope this video can help you or someone you know that has suffered from neck pain and headaches. Now, of course, there's more to it than that, but I urge you to rewatch the video and try to figure out how to solve and treat your own neck pain. If you're tired of having headaches and suffering from neck pain and taking medications and wondering when your neck pains or headaches are going to stop, give me a call and I'll help you find a solution to your problem. Thanks for watching.